Good morning, everyone. Brief description about this FMR case here in my friend's clinic. So, this is the cast wherein I have fixed the cast bar framework onto the implants. Okay, so here also we have followed some different procedure wherein uh, we have fixed the cast bar to the both upper as well as the lower implants. That is a full mouth rehabilitation case wherein I have placed some 10 implants in the upper and some 7 or 8 implants in the lower. So after that I took the impression with the help of impression coping and an analog. So accordingly the technician has fabricated the metal framework. So in this case we have used this framework as a jig trial, wherein we have trimmed the excess implant upon placing this after placing this framework on the implants. I have trimmed the excess implant. So after that I have fixed the framework to the implants both in the upper as well as the lower. I have fixed the framework to the implants in the both the arches. Okay, so with the help of luting cement. Okay, after the jig trial we are going to remove the excess implant, and after that with the help of luting cement we are going to fix the cast bar framework both to the upper as well as the lower arch, that is in the mandible as well as in the maxilla. Okay, so after fixing this framework to the maxilla as well as mandible, so what is the advantage of fixing this framework to the implant itself? Okay, what is the advantage? So if you can fabricate this metal framework within 2 to 3 days after implant placement, if you're a technician, he will give you this framework within 2 days. You are going to fix this cast bar, which is also used as a zig trial upon the implants. That is, going to fix it on the implants. After fixing this one with the luting cement, this acts as retaining the implants in the same position. So it's a kind of zinc crystallization. Zinc crystallization is a process wherein you are going to join all the implants together with the bar or otherwise through the process of welding. That is called as a zinc crystallization, wherein your all implants will be connected to each other and all implant will be at the same place, and all the implants will be stable. They won't move. There won't be any movement of the implant. Even the micro movements usually will not happen with the help of zinc crystallization. So I am not done the zinc crystallization using the machine like a zinc crystallizer, but have fixed the framework to the implants itself on the both upper and lower. So this will help to retain the implants in the same position and also maintaining the stability and anchorage of the implant. Okay, so after fixing this framework, you will get time, in the sense if your prosthetic procedure is delayed for some days, so this will help. This fixing the framework to the implants will help you to maintain the stability of the implants for a longer period. Okay, so that is what we have done. This is the new technique. So today for this patient, everything is ready. The trial is ready. For this patient I am going to give this hybrid denture. He has given both fabricated both upper as well as the lower hybrid denture on this cast bar framework. So this is the upper one. This is the cast bar framework which is fixed on to the patient's implants in the mouth. So I am going to insert this in the patient's mouth upon the cast bar. Okay, so this is the upper one. Just place it here. Just a minute. Sorry, it's the upper one. Okay, exactly, it's seated, and this is the lower one. I'll show you. Okay, it's the lower one, absolutely perfectly seated onto the framework. Okay, this is the trial which has given in the wax. So trial insertion, this is I'm going to do today. Can you see the occlusion, the teeth setting, occlusion on the posterior and both the sides? Some the type of it's almost like a class 1 kind of occlusion. The patient, maybe the patient was having when his natural tooth were there, I think he was having class 1 relation only. So we have given the class 1 relation here. Okay, can you see? So he has given the proper teeth setting with the bite on both the sides. So lower he has given till molar on the third quadrant, and in the fourth quadrant he has given till second molar, and the upper one he has given 2 molars on both the sides, so with all the anterior teeth. So this is the trial insertion for this Shankrappa patient. So his name is Shankrappa and is 61-year-old. This patient is a case of a chronic periodontitis case, wherein the patient was not having any caries because of his bad oral hygiene and not good maintenance of his oral cavity. He lost all the tooth due to periodontitis. So all the tooth which were left out while starting the treatment, I got all the teeth extracted and the implants were immediately loaded. So loading was done few days back, I think it's a 7 or 8 days back. After all the prosthetic procedure were there, we are in this stage now, we are in the trial stage. So in this trial stage, I am going to do the trial insertion and a check in the patient's mouth, that is look as well as shade of the tooth as well as the occlusion. All the matters, I mean all these things matters, we take everything into consideration. So if everything is fine, so it will be fine. So we'll give it to the lab for the final fabrication. So that is, this patient treatment is full mouth rehabilitation with the help of hybrid denture. This hybrid denture will be fixed in the patient mouth with the help of the implants which were placed both in the upper as well as the lower jaw. Thank you.